Good evening. I'd like to call to order the meeting of the Opioid Settlement Fund Advisory Committee on March 18th. If we could all first stand and do the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Okay, I need to make an announcement that under Mass General Law, Chapter 30A, Section 20F, this meeting is being recorded. First, on the agenda this evening, we have a guest speaker who had a community resource that is currently active, is Sean Verana from the COSUP program, or COSUP, which is from Bristol County Outreach. If you would be happy to come up and sit here and tell us why you're here and about your program. I know that Chief Dunn has already told us, and we had 2 officers come who were involved in that program. Tell us about it, but we'd like to also hear from you.
Well, good evening, everybody. I'm Sean Verano. I'm a senior research associate with Kelly Research Associates, which is based out of Norwell, Massachusetts. I'm also a professor of criminal justice at Roger Williams University. As part of the work that I do, myself and Pam Kelly, we work with community-based collaborations really throughout Massachusetts who are focused on issues of substance use disorder and really the engagement of police in this deflection space, which is what we would call it, which are these programmatic strategies that involve police, fire, and other first responders, partnering with recovery partners, intending on really leading with treatment-focused approaches to the overdose crisis. Several years ago, Pam and myself worked with the Seekonk Police Department to develop a federal grant proposal to the Department of Justice, to the Bureau of Justice Assistance, under the guise of the COSUP funding stream, which is I forget the acronym, but it's the Comprehensive Opioid Substance Use Prevention Program or something to that effect. The intent of the program was to fill a need we saw at the time in Bristol County, which was, a lot of grant funding goes to places like Fall River, to places like in New Bedford, who tend to be sort of the grant recipients to do this kind of work, recognizing that smaller municipalities really had a need, but didn't necessarily have the business, if you will, or the need to drive a large federal grant program. So we decided to create a coalition of police departments and municipalities in Bristol County who at the time did not have federal funding nor the ability to be involved in this sort of recovery space. The grant submission was done through the Seekonk Police Department, really through the town of Seekonk, but the program was designed to be a coalition of participating communities. The grant was awarded at the amount of $800,000. It was funded for 3 years. We have since received an extension by the Department of Justice that will go through the end of September 2025. Myself and Pam, we work with the Seekonk Police Department, and we kind of manage the project. We help to coordinate it on your behalf of Seekonk. The primary funding that the grant will provide is for overtime and training, and also supplies like naloxone, harm reduction kits, other kind of harm reduction supplies and strategies to be used with outreach efforts. While the project started mostly around the overdose crisis, a lot of communities at the national level, this is in the time frame of post George Floyd's death, behavioral health, mental health calls for service really became a defining part of police work. So a lot of these community-based collaborations expanded beyond just overdoses to develop or to use similar mechanisms and strategies to support people in their community with mental health and behavioral health problems. And from a clinical point of view, I heard you talking about your clinical experience, these are comorbid problems to begin with. So a lot of times when we're dealing with our population with substance use disorder. We're also dealing with people who also have, as part of the risk factors that are driving them to substance use disorder, behavioral health and mental health costs. So with that in mind, Bristol County Outreach is the umbrella under which a lot of these efforts are done. And certainly when Chief Dunn became the chief, he was very interested in becoming an active member of this collaboration, of which your agency has which your community has been part of for months. So right now we have the ability through the end of March to support really the expansion, if you will. I'm not really sure that it's an expansion. It's been a resource that is there, but to provide overtime funding both for police officers and your civilian recovery partners to get to expand the engagement of the Westport Police Department in this kind of an effort. The chief and I have spoken at length. We are at a point where we have resources, quite frankly, to be spent. And we really need to expend those resources by the time the grant cycle ends in the end of September of 2025. And so one of the conversations that we had was, I certainly know there's interest on the chief's part in really building this capacity within the Westport Police Department. Again, I'm not going to speak on the chief's behalf, but maybe at some point in the future to acquire resources for a civilian clinician to be part of a behavioral health approach. Again, very much I would say that Massachusetts is a leader in that space. The idea of collaborating, civilian clinicians with police officers in terms of doing the work that they're doing in terms of really facilitating access to behavioral health and substance use disorders support. So in the meantime, we have these resources, and we had indicated to the chief. I don't like to say there's unlimited resources on the table. That's not true. But there are expanded resources on the table through the end of September to potentially meet Westport's needs. And we had thrown out this idea of really using this as a pilot period for you guys to develop, like, what does this look like in your town within your coalition of community partners and stakeholders with the long-term goal of potentially expanding this into more permanent resources. So with that in mind, again, the resources are primarily overtime, both for the police officers and the civilian recovery partners or clinicians who are part of this effort. At this point, we have clinical resources. The way that we've been doing this is we have some clinicians throughout the county, and this is, quite frankly, special space. I mean, there's not a deep history of a lot of clinicians working within police. And quite frankly, there's not a police with deep history of working with civilian clinicians, right? This tends to be a point where there's not deep histories of collaboration. I would argue to you that it's incumbent on these kind of efforts to make sure you partner the right police officers with the right civilian partners, because we have to make sure everybody's well aligned with doing the important hard work that's being done out on the field. So we've been leveraging some of the, in a per diem basis, some clinicians who have an established history of working in police settings to make sure they're comfortable in that police space. There's, issues of HIPAA and Part 2 and some clinicians don't even want to go into this space because they don't really know how HIPAA deals with. And so anyway, I would just argue you have to find the right people to be in this space. We have clinicians, and I know there's been some talk of expanding to this region a specific clinician to work with some of the contiguous communities down in this region. So I'm going to shut up now. So I don't know if that answers your question. I'd be happy to field any specific questions that you might have.
Anyone on the board have any questions? Mr. Morano.
Thank you.
Thank you.
So this sounds like, some of the funds can be used or are used for harm reduction supplies.
Yep.
For the outreach efforts. Is it possible for some of those also to be made available beyond the specific outreach encounters?
Yes.
With this grant?
The short answer is yes. The longer answer is depending upon what the ask is and what the resources are. We've been a conduit to getting naloxone. So there's a, Chief, you might know, or your lieutenant, you might know better than me. There is a mechanism throughout the state for municipalities to get naloxone. We are one of those entities. So if we have a police department that calls up and says, we need, 20 boxes of naloxone, we can provide it to you. Our harm reduction supplies, again, harm reduction can be kind of a trigger word in some communities, so that, and they can look like different things in different places, right? We tend to use the term a client support kit, because it's what resources do people need who are in recovery. Those client support kits can be pretty creative. Sometimes they're hygiene products, first aid kits. One of the issues with the fentanyl supply is that it has xylazine and other things in it which are create wound healing problems, and so we'll have wound care kits, other hygiene products, making naloxone available. The short answer is, within reason, we can all the chief has to call up and say, hey, we need 50 client support kits, and under most circumstances we can provide those. So let's say you have a community event and you want to have Bristol County outreach to have a table manned by police officers from Westport Police Department, make harm reduction supplies available. Assuming you're comfortable with that as a community, we can help to provide some of those resources.
Could it even be something that wasn't tabled? Like, I'm thinking, again, instead of potentially piloting, having those harm reduction kits, at the health department, or with the Board of Health, or a couple of other town sites. I know they're available, at least at fire, I believe at police as well, but places where people might feel a little more anonymous,
right?
Going in.
The short answer is yes. There's nothing that prohibits us from our funding. We are, just like everyone, we try to stay within the guidelines of our funding. This was provided by the Department of Justice largely to support this collaboration of municipal police departments. So, but again, within reason, we have ample resources at the table. Essentially, whatever the chief calls us up and asks us for, assuming we have the resources there, we will do it. If he came and said, could we have 400 kits? Probably not. But let's say, could we get 20, 30, 40 kits? I don't anticipate a scenario where we would say no.
I heard you say that you were something till the end of March.
End of September. If I said March,
You said March 1st.
I meant Okay, I meant the end of September. That would be the end of the grant. The grant year, the 1-year extension. We had at one point discussed requesting another no-cost extension by the federal government, but there's weird times in the federal government, and so we are just planning on the federal government saying no to all of this stuff. So right now, I know the town of Seekonk really wants to wrap this up by the end of September. So we are doing our best to be mindful of those resources and making sure they're spent down accordingly.
Okay. So then, if we're not sure that there's going to be funding, because this is one of the issues why we're having you here, is that we have funds, we're trying to figure out the best, a good allocation for those funds, and where would be a good place for those funds to do their best work. So this is one of the things, is whether or not we would be able to bridge, or if there's something else that might help bridge so that we can continue to support that program.
Well, I know that through underfunding mechanisms to the state of Massachusetts, which has been the jail diversion clinicians, which has been a funding stream. I don't remember if it's under Department of Public Health or the Executive Office of Public Safety and Security, but the jail diversion clinicians, I don't like that term. I'm not really sure where the state of Massachusetts ever came up with that, but it has been funding through the state of Massachusetts to hire clinicians who are based out of police departments, right? So like the Easton Police Department has one. Several departments in Bristol County. Actually, I think that Bristol County is a bit ahead of the game in terms of having municipalities that have been able to secure a clinician who's employed by municipalities to work in collaboration out of police departments. This is kind of weird space because you can at times get a clinician that works for a service provider. So when you get into questions of compliance and all of this kind of stuff with HIPAA and Part 2 and all of these things, you're dealing with not only town compliance questions, but then private vendor who might have their own compliance people and their own attorneys. And, there's all this question about sharing and information sharing and what can clinicians do and what can't clinicians do. So by putting the clinicians directly with the municipal unit, it kind of simplifies some of, not that HIP is still an issue, because they're still covered entities under HIPAA, but we find that it's just a much smoother process in terms of those collaborations. So the bottom line is, from a long-term point of view, there may be resources on the table for the clinical support. And really, a lot of what we're finding is that a lot of municipalities, there is this behavioral health and then this overdose problem, right? And those are two separate but related problems often. So, and what a lot of smaller municipalities are doing is kind of collapsing their efforts into not making the difference between the two, right? You have a clinician who feels comfortable within the recovery space, but also within the behavioral health space. When you get into the pure substance use disorder space and you get into the harm reduction space, into the peer recovery space, some of those peer recovery experts don't really feel comfortable in the behavioral health space because it's out of their lane, right? And they're not necessarily clinically oriented people, right? And so you can kind of take these efforts and, I would say, in a smaller municipality, merge them under one umbrella because, quite frankly, they're very similar problems.
Can I ask a related question? Have you seen, I'm more familiar with the Plymouth County outreach from having done opioid overdose prevention work in Brockton and a lot with them, but I know that the peer recovery coaches are an important part of that program. Have you seen communities do both, smaller communities or sort of a collaborative of communities, because they can play different roles?
Right. So Pam and I helped create Plymouth County Outreach.
Oh.
So we were the original research partners who were attached to that with all the 27 police chiefs and built Plymouth County Outreach. And actually, we modeled Bristol County Outreach literally on Plymouth County Outreach. What I would say is that Plymouth County, because they were kind of an early leader in this space, and it, I think, was just a product of the time period, very much had a strong peer recovery element. And as and they build a lot of infrastructure and funding around that because, again, I think these things, these ideas, these concepts look very different in different communities. And when you deal within the peer recovery space, sometimes there's no funding, right? You're asking recovery coaches to go out, they're not getting paid, right? Well, they have their own basic needs also. So Plymouth County Outreach was able to secure 3 different COSUP grants, actually, over the years that have provided this peer recovery support. I don't really want to get into too much of the history of peer recovery within Bristol County Outreach. I will only say that for the first couple of years, we really tried to find a strong peer recovery partner. At one point, Heron House was part of the collaboration, and it just didn't work. The logistics of getting people throughout the entire county, going to police departments, also feeling comfortable within police departments, doing recovery work. It was a dynamic that, as of right now, just didn't play out in Bristol County. I'll speak for myself. I don't think to the harm of the effort, right? I think you work with the local context and the local resources that you have. One of the real assets we found very early on in Bristol County was there were some very well experienced clinicians who were actually police department, who were working with municipal governments. And quite frankly, I'm going to tell you, I haven't seen a lot of that throughout the state of Massachusetts, where when you would have a clinician go out, like your folks, I think, love our clinicians, right? They're really good clinicians, right? They get police culture, they understand police organizations, they understand, they're comfortable being out in the community, quite frankly. Not all clinicians, are out in the community, quite frankly, in some dynamic places, shall we say, and dynamic circumstances. So I would say you guys have that as a strength here. Build on your strengths, and that's not to say a long-term goal could not be to build out to complement that with peer recovery support. But right now, we just we weren't able to kind of whip up those kind of resources and get a sustainable kind of resources in that space.
Any other questions? Yes.
Sean, thank you for coming. One of the questions we spoke about is 6 months is going to be right around the corner.
Yeah.
So in your opinion, how do you think we should proceed? Not only, because this is a pilot program that we're part of, not only as a town, but maybe about integrating amongst other towns and kind of supporting one worker to come out where different agencies. I guess what I'm saying is, what advice would you give our committee as to how to move forward between now and September?
Yeah, I mean, again, and I would be, I mean, I know the chief pretty well at this point, and for whatever it's worth, I'd be always happy to lend my views on things. I mean, I have a deep history of working in this space, spent probably 5 years working with the city of Providence and their co-responder model, which was an, embedded clinician with the Providence Center and others. So I have a pretty good amount of experience in the space. To me, I think one of the questions in terms of the civilian engagement in policing is, quite frankly, is there enough workload to justify a full-time clinician in a town the size of Westport? And, unless the compelling answer to that on your part was yes, my gut says probably not, right? And how do we think about sort of the regionalization of these assets, right? And I think of 6 contiguous towns as a small city of Providence, right? That clinician in the city of Providence, they have a 24/7 one clinician who's embedded with a patrol officer, and that's kind of a floating resource, right? And so that resource is handling 911 calls as normal 911 calls, and then if there's a call that needs a clinician, that's a flex resource that can float anywhere within the city of Providence. To me, that's an analogy how, for personally, if in a scary world where somebody wanted me to be the police chief, right, I would think of that, through a either mutual aid agreement or just an MOU between police departments. Maybe a clinician could float around and one night a week or one day a week go to a different community partner, but there's an agreement that says if that asset is needed, in any other participating town, that's something like that. I think could be a kind of a strategic way of doing this. Looking at how one of the ideas that we had was, I think there's a lot of questions when a police department moves in this space, and I think you have to be. My experience is very intentional, right? Know what you want to do, know where the landmines are within the space, and develop not just the culture, but the policies and procedures around it. And I think you don't necessarily have to rush into it. I would think of this 6-month period as a planning period. Let's use the resources that you have, and draw on some of the clinicians that we have, or I know there's talk about, one of the problems that I think some of the departments in this area have faced within Bristol County is the resources they're drawing on are largely from the northern part of the county. And so while these clinicians are really good, right, the communities that they're most familiar with are up in that area, right? The logistics of getting them always down here can be a bit of a challenge, okay? And I think the chief's values are, which is the values of all good, public safety experts, is, they want their people to know their community, right? To be part of their community, to have, this is one thing about just doing an outreach visit, but it's about building relationships with some very at-risk people often living within our community, and that takes time to forge those kind of partnerships. So I know one of the values the chief had said is the need to really have these resources be more localized, so there's a comfort and familiarity. So to me, if the aspirational goal is to, within the next 6 months, really start planning around the resources, you really essentially have, again, I'm never going to say unlimited access to overtime, but you have almost unlimited access to overtime to amp this up and use this as a pilot period of putting the infrastructure. I think one of the ways that the municipalities or one of the questions you ought to have is, do you all want to hire a full-time eventually is the goal to hire a full-time person, a per diem person? Do you want to use 2 or 3 clinicians that are per diem that are more flexible because they're not, Monday through Friday, 8 to 4, right? They're more, we have 60 hours of clinical time in every 2-week pay period, right? So you could think about it in terms of either full-time people or per diem, but as a shared resource, to me, makes sense. And I see, small municipalities as that's really what these assets should be, regionalized.
I have a question about cost.
Yeah.
So the situation where we have a shared social worker or clinician that goes out with police. What does that cost?
So, I should know the answer to this. I mean, I bet you, right, for Bristol County outreach, I suspect that the clinicians bill us probably something like $30 an hour. I'm just not sure right off the top of my head, ma'am. So I could find that out for
It
you.
would be helpful because as we're
Yeah.
looking at what funds we have, I mean, we're a smaller municipality compared to a Fall River, New
Yeah,
Bedford.
yeah.
So, knowing how much something may cost and how long we would be able to have
Right.
that service.
Right.
Is important.
And I think with the opioid settlement funds, which are, I assume if Westport's like everybody else, it's enough like you feel like you got to do something, but not enough to, change the world, right? The per diem approach might be the most flexible approach, right? Because you can basically budget it based on the resources that you have, right? We can provide, now again, any clinician that's going to partner with any coalition is going to want to know that they have a certain expectable income. I think that's a reasonable ask that any of us ought to make. But I can tell you specifically what resources, how we pay I'll tell you, I just don't have the numbers on me right now. I'd be happy to follow up with the chief. If you're looking for a model of a municipality that has a clinician, I know the town of Easton does. They have a full-time clinician who, and I think her time floats around, that's Stephanie, or one of them are full-time with Easton. And the way that Easton has it set up is like X number of hours a week are allocated, like some to the school, maybe 1 day a week to the school, 1 or 2 days a week to the police department, maybe 1 or 2 days a week to fire. So it actually is, instead of it just being a full-time police resource, it's a municipal resource, if that makes sense to you. So you could think of it in that way in terms of sharing it within the town, across different need bases across the town, or across towns, through this regional approach. But I know that Easton could be a good, you may reach out and again, I can find some more information out for you about maybe who a point of contact would be.
That would be great. Thank you. Yes? Val?
One quick follow-up, because that's an interesting idea, is just how do they fund it? Is it from the town budget? Is it from grants?
I'm not sure.
Mixed?
I believe they were awarded a jail diversion clinician, but again, to be honest with you, I'm just not sure right off the top of my head.
And I quickly looked that up. That's a Department of Mental Health
Yes.
program here.
Yeah.
My other question is kind of to you and to Chief Dunn and to you, Westport is part of a public health regional collaborative. There's not an analogous police regional collaborative in the same way, but is there a way, well, two-part. I wonder if there's a way to leverage those communities and the public health collaborative to contribute to something. And then do you feel like there are any surrounding or some surrounding police departments that would make it worth exploring the model of a multi-town collaborative?
I think the 5-town collaborative, they don't really border Westport. I believe it's Mattapoisett, Freetown, Rochester, Lakeville, maybe?
Yeah.
So I've had proactive discussions with Chief Levesque from Dartmouth about, trying to get to bordering towns. Dartmouth and Freetown maybe, in Westport, some to that effect. I think that if we could do the 5-town, that would be great, but again, we're not touching these other communities. So we talk about like the localized option, I would definitely prefer having that option. But I know Chief Levesque, we've had proactive and definitely great conversations about exploring this later on down the line, because we've talked, Deshaun, with Chief Levesque, like, hey, we need to start getting ahead about this. We don't want September to come and then have, what are we doing?
Have you spoken to them about their settlement fund in Dartmouth?
I haven't, but assuming, I believe they're twice the size of our community, I'm sure the settlement fund is.
I don't know if it goes by size or it goes by impact, like,
I think everybody, it's online, we can all see what
Yes.
each community gets, but I didn't get so far as to what they received.
because it could be, they encourage collaboration between municipalities.
Sure.
So we may be able to work with just Dartmouth and say, you have these funds, we have these funds. Can we combine the funds to hire a clinician to cover the mental health but the opioid
Sure.
For both towns?
for both towns. I know that the collaborative that we have, that we're, the town of Westport is involved in, I've spoken to Matt Armendo, who is the the director of that collaborative. And he said there shouldn't be any problem with using collaborative funds, but you also have to discuss with all the towns about whether or not they wanted to be involved in that. But we certainly have the flexibility of joining another community and sharing them.
I think the other thing we have to realize too is that we might be well ahead of the game, meaning with our task force that we have here, where other communities haven't even established one yet. So if we're going to deal with 5 communities, like you said, there might be 5 MOUs and different people in different states of where they're at with their funds, where if we just deal with one, it kind of streamlines it, and we're only dealing with one.
But the other issue is that some towns have their select boards control or manage the money completely, and others, like our town, our select board has the control over where the funds go. We're an advisory committee. But there are other towns that have handed over their money to, say, the Board of Health to make all decisions about. So that's also part of the process, because if they have advisory committees or the nurse, the town nurse advises this, the select board still has to vote on how that money is distributed. So, but that's something that I can work with Olive
Okay.
and with Matt on, is talking more about the collaborative, but Dartmouth isn't in our collaborative.
They're not.
Yeah.
Can I just only mention that once this grant is over, so when what we call Bristol County Outreach is a name on paper only. There's no 501 status, or there's no legal entity that, as we understand it, called Bristol County Outreach. The grant recipient is the town of Seekonk. That is who gets the grant award. That being said, I know when this grant is over, the Seekonk Police Department has no plans to continue Bristol County Outreach as we understand it, right? They're just, and for no particular reason, they've had their fun, right? So I know that like Fairhaven, and Chief, I'm not sure what your collaboration is with Fairhaven, but it certainly is itching to kind of become, to take over, right? And to keep this informal coalition of police departments going, just so you know. So alls I would say is, from a mechanism, Bristol County Outreach could be a mechanism by which whatever efforts, could potentially continue, because that will no longer formally operate after this grant is over, if that matters to you, but if that plays into decision-making either way.
Yes, Craig?
There's also some settlement funds, I understand, that are being effectively held back by the state, and that they're, like us, they're not spending all the funds that have been received to date, but they're finding an orderly way to disperse funds. And one thing, that there's going to be some supplemental funds available to municipalities, probably in the next 6 months, A, and B, they're going to look very favorably on collaborative ventures between communities.
Yeah.
So to the extent that we can explore those types of collaboratives in a fairly systematic way would make some sense.
It's helpful to have somebody who's working on the Hill. And I believe that other communities are looking to figure out what they're going to do. And I know that the state held back 60% of the funds.
Yes.
And then gave 40 to the municipalities. But that doesn't, as far as I know, include the last suit that was settled by the Sackler family. So there could be even more than the set over $1 million after 2038 that we would receive. But when you think about it, $1 million over a span of time isn't really a lot of money. We have about 317,000 now. And so we're in this process of saying, where do we want to fill, not compete with other entities like what STAR does,
Right.
and we don't have any infrastructure here at all that deals with helping people with recovery. So our process is to try to figure out what can we do to build bridges to those services, and also to create something here that people know they can access some assistance and help. And this program, which we didn't know about before we started this committee and Chief came on, was this is a wonderful thing.
Right.
And it's so good to hear that money has gone towards this process and pairing clinicians with police so that there's more of a de-escalation and a help attitude, as opposed to when people see police, it's, I'm in trouble. It's like it's much more supportive kind of role.
Well, what I'll tell you is that I've been operating literally in this lane since about 2016 and squarely in this space. And this is the first meeting I've been part of and I'm aware of that has anything to do with the settlement funds, right? And so, I'm not saying there's not other, getting to your point, are you ahead of the curve or are you behind the curve, right? I will only tell you, I think you're ahead of the curve in that literally, all the work we've done in Plymouth County, right, and we're deeply, deeply involved in Plymouth County. There's been no leveraging of settlement funds for any of their post-overdose work, right? And to my knowledge, nobody still knows what's going to happen with that money and we're how many years post-settlement, right? So my gut says you're at the pinnacle of the curve or you're actually ahead of it, because this is the first conversation I'm aware of myself. I'm not saying that I have my fingers in every corners of every community, but I just applaud your sort of planning ahead and really trying to finally move this conversation forward about how these settlement funds are going to be spent.
We can thank Olive Wachowski for that.
Awesome.
She she worked in Rhode Island, working in recovery and support in Rhode Island. So she is our coordinator of the collaborative, and she inspired me to work with her to create this advisory committee. I did see something recently that said the percentage of funds that have been spent in the state of Massachusetts is small. It's a low percentage. So that for us not to feel like we got to hurry up and catch up, there really is a lot of municipalities are not knowing what to do and are trying to figure that out and have not spent money.
It's becoming to be a public issue.
Yeah.
Yeah,
Media's onto this.
yeah.
I don't know whether it was New Bedford or Boston or both. There's been some
Right.
reporters started scratching around trying to figure out why is all this money sitting unused.
Fair. It's more challenging here because there's 351, towns, whereas in other states, county-based
Counties,
systems,
yeah.
it's a little more streamlined.
Yeah, that's why they're trying to encourage the collaborative process, so. All right, are there any other questions? Thank you so much.
Thank you.
For coming here.
You're
and
welcome back
speaking to us.
anytime.
I have one more.
And
Oh,
thanks for
wait a minute,
encouragement.
Thank you.
that does.
I think it's, you may have answered already, so forgive me if I just completely forgot. But as we talked about, behavioral health and mental health needs, beyond post-overdose, can you remind me what the criteria are here currently in the program for, is it only post-overdose that you go out for?
No. No, so right now,
Area?
the BCO being a police-led effort, and we could spend an hour on that, but we trying to stay in the lane, right? Because when we deal with HIPAA and Part 2 concerns, when we bring that into a police space, both of those legal concerns are at arm's length, right? Police are not bound by HIPAA. So the idea of collecting and sharing data with police to civilian recovery partners, we can do that, right? It's not to say that data collection and data sharing within the police space is not bound by privacy issues, but formally police are not bound by HIPAA. So under Bristol County Outreach, the umbrella is a police-focused effort where police departments respond to 911 calls that involve overdoses or behavioral health events. They identify those events, share those information about those events with connected stakeholders. And a classic example might be somebody has a overdose in Seekonk but lives in Westport, right? The appropriate data share would be, our response would be based by Westport, because our responses are where people live, not where incidents occur, if that makes sense to you. So the Seekonk Police Department would do a referral to Chief Dunn and to his team saying, hey, listen, Robert Smith overdosed on this date. You may want to consider bringing a recovery team out to their home to try to bring recovery support. Those same mechanisms, that same framework is also used for managing behavioral health and mental health calls for service. Now, it doesn't mean that every police department, so right now it's a local decision. Bristol County Outreach started around overdoses, but some have extended it beyond overdoses to behavioral health. I believe your department is doing behavioral health, mental health calls for service, and when appropriate, will mobilize clinicians to follow up to those behavioral health events, to use the same business processes, the same relationships, again, to bring very similar access to support. I wouldn't call it recovery support, but there could be a substance use disorder in that home, in that scenario also. So the short answer is yes.
Got it. Thanks.
Well, there's a lot of correlation between mental health issues and substance use disorders or use issues. So it's great that it's covered. And in the abatement agreement, it talks about the importance of addressing, especially with our youth, that we're addressing the mental health issues that could lead to substance use disorders and substance use. So thank you. Anybody else have any questions before we, okay? Thank you again for coming.
Any reason to stay? If not, I'm going to leave. So,
Nope.
all right,
Nope.
thank you.
Thank you.
Thank you so very much for coming, Mr. Varana.
Thank you.
All right, so I think the next order of business is the approval of the February 18th minutes. Did anybody have any changes? Because I had one. One of the changes, and I wanted to be clear, it says on other updates what Mr. Dorsky, Dr. Dorsky distributed a draft template for interviewing grant applicants. That's not what this is. It's for interviewing interviewing, what's the word that we use?
Informants.
Key informants, stakeholders, to get their input on where they think suggestions for where people, the most needs are in the community and where we should look at distributing funds. So it just had to be clarified that it's not for grant applications and evaluating proposals or have anything to do with the grants itself. It's just interviews from stakeholders, especially healthcare workers, healthcare doctors, social workers, any clinicians in town who are providing therapy. That was the focus. And other than that, I did not have any other changes. So if there are no other changes, I'd like a motion to approve the minutes.
So moved.
Okay,
I'll second.
right? All in favor?
Aye.
Aye.
Thank you. Okay. All right, now we go to member updates and reports, and I have first the interview questionnaire revision. Some of you had, I think Val and Pam, did you send suggestions to David? He's not here, he couldn't be here today, he is out of town.
I didn't, I was supposed to follow up to ask him for a version that I could write on, because it's a PDF, so we can't, so I haven't yet, but I have, what I can do is just put them in the body of an email to get them to him.
Okay.
I just had a
Again, the interview questions might be used if we're going to do more, well, we are going to do more focus groups, but it is a questionnaire. I don't believe he was going to call and ask the questions as much as present the questions or the questionnaire to health professionals. So he was just looking for the support from the committee to go ahead, once the changes were made, to go ahead and start making those calls. Are there any objections to Dr. Dworsky reaching out to clinicians in town and using the questionnaire, the interview questionnaire? Again, I would suggest that if you do have an addition or a change in wording, that you report to him, and he can make the changes accordingly. But it looks good.
So he plans to call.
He plans on moving forward and reaching out to clinicians. I asked him to because he is a physician.
Right.
So I asked him if he calls physician to physician in town, and even to any of the therapists that are in town, that would be helpful. If I can also reach out to the therapists in town, but Dr. Dworsky said he would like to go ahead and connect with the clinicians. All right, so, anybody have any updates for us or reports on what's been happening between the meetings?
Yeah, I'll start with it.
Okay.
My homework was to go to as many of the AA meetings in town and ask how they felt we could help with addiction and things, treatments and stuff. So on Tuesday night, I went to the Pacific Union meeting. There were 23 people there. It was a very good meeting. It's not always that full, but it was a good time for me to show up. There were quite a few people. The amount of, out of the 23 people, 5 were residents of Westport. Out of the 23 people, it's an AA meeting, but there were 3 that were there for recovery from opioids.
Okay.
I asked most of them didn't even know about the funds. And when I asked how do they think we should best use the money to help people struggling, the first response was sober houses. That the big problem is when they come out of detox, they have nowhere to go, and home is not an option or a good option. What I had added to that was perhaps helping to fund people to be able to go into a sober house, which there are already, through the Heron Project and through other places in Fall River, they already have they give out scholarships. And what they usually do is pay for the first month, which is about $700 for a room. And it's not a private room, but it's a shared room. And what they do is they pay for the first month, because normally the first month, whoever's there normally isn't able to work yet. They have to do 90 meetings in 90 days and blah, blah, blah. So they'll usually pay for the first month while they can't really work and pay for it themselves. The second month, they'll pay half. So they'll pay $350 or whatever. And then the third month, they kind of wean them down, to help, hopefully they get a job and then they can start paying for themselves. The other suggestion was transportation to meetings. Another person mentioned it would be great to have an outreach program at the old high school, maybe have a room where people could actually go, and a physical place that they could go during the day to talk to someone, or, maybe have a meeting there during the day. Because they only really have, I think there's only 3 meetings in this town. I was able to go to 2. The one I really want to go to is on a Saturday night right here at the Grange. They say that's a very good meeting also, and there's a big showing at that one, so I'm hoping to make it to that one next. But they also, one woman spoke and felt that education for the students in the town is very important, to try to get them educated at a young age. Then on Sunday night, I was able to go to the Quaker Meeting House. They have a 7 o'clock AA meeting, so they're both AA, but they both have mixed. We don't have an NA meeting in town anymore. We used to, but that's gone. How many people were there? 7 people attended. 3 of the 7 were in recovery for opioids and alcohol. 1 out of the 7 live in Westport. And they kind of had a lot of the same suggestions. Actually, it was pretty much the same. And they all mentioned the old high school, using the old high school, which was interesting. A drop-in center at the old high school would be helpful. Meetings during the day that could be offered there. They need more resources and help with sober living.
I got a question. Are there any NA groups in the adjacent communities?
Oh, yeah.
Because if that might be where a lot of the folks from Westport.
That's right. Yeah, and I'd be willing to go to others. I know there's a few in Dartmouth that I know of, and I'm willing to just keep researching and ask the same question as anyone here from, reside in Westport. But I will definitely go to the Saturday one here and get some more information. When I did speak to the girl from the Heron Project about how the scholarships, where that money comes from, and a lot of it's from donations. And we talked about the possibility if they could somehow apply for some money from Westport and use it only for Westport residents that are looking for sober living. So that's a possibility too.
Okay, thank you.
You're welcome.
All right, anyone else have any updates?
I have a, real quick, as far as you mentioned, Pam, you mentioned the schools, I'm 100% behind that. I have, Don, you sent out that email that I sent to you. I have a specialist coming in on May 6th to speak in town at the fire department for the paramedics, but I wanted to open it up for the committee as well. Just give you an idea from beginning to end. So he works for the New Bedford Fire Department. I think he started it 20-something years ago, but he specializes in narcotics, all different drugs. He works with the Mass State Police, Massachusetts Firefighting Academy, has a solid background in opiates and going around and finding the pill presses, all the white powders out there, the fentanyl, everything that we're discussing. So he's coming in. I know you signed up, Olive signed up. If you have a chance to go, it is on May 6th. I'll forward you the pamphlet as well. I have him, he's available to come to the schools to speak as well. But he has the background, he's a paramedic as well, but he specializes in this. So his 2 to 3 hour lecture is going to be, don't start in the schools, don't take drugs. Drugs are bad, period. However, it's not a perfect world. If you get into doing this, what's the next step? You mentioned about rehab. How often does rehab work? If you can get into rehab and it's working for you, then you enter recovery, which is the rest of your life. Okay, and every step's a battle. And then you mentioned about sober houses, sober living. So I wanted to ask you, did you get any, when they talk about sober living, do they give you an idea what that means to them, or?
Well, what happens is after a detox, which is normally only about 7 days at the most, that's all the insurance covers, or that's all it takes to detox someone, they really prefer them to not go right to a sober house. There's a halfway house, there's other programs that are more strict. They can't work, they've got to stay, they've got to do meetings all day. But a lot of them want some freedom, right? And they want to be able to go back to work. So sober living is an option. So I spoke to a man in New Bedford. So they have sober houses in Fall River. They have sober houses in New Bedford, but not a lot. But they have them all around Massachusetts. And what they do is they interview the person right out of detox. And they say, the only way you can stay is if you do 90 meetings in 90 days. This is the way this man runs it in New Bedford. 90 meetings in 90 days. And then eventually, after usually around the first month, they allow them to get a job and work. And, they have curfews and they're being monitored. They do urine tests randomly, breathalyzers randomly. They're not allowed any alcohol in the house or anything. And they supply transportation sometimes if they need it for the meetings and all that. But as soon as they mess up, they're out. They get kicked out.
So, but they got to be on something so they don't crave the need for opiates, though.
Always.
My question, so when they sober living, there's got to be something that craves that, where they don't want to go back and take any kind of drugs, any kind of narcotics.
Like methadone or Suboxone.
Suboxone, methadone has been around forever.
Well, we happen to have somebody here who works for Stepping Stone. Dina, can you address that? Would you be happy to come up and just say what it is from your perspective? And because you're talking about medication-assisted treatment, and not every person gets medication-assisted treatment.
So I work at Stepping Stone, Dina Desmaris. I have the clients that go to the outpatient clinic. So all of my clients have been to Detox Star usually. Then they go to CSS, which is a step above, where they still have to stay there and they live there. Then they go to a sober house, like you were talking about. We own 5 sober houses. They're actually residential treatment. They are allowed to go out after 30 days, massive restrictions. They're there for their recovery, mostly. Some of them are made to go there, but a lot of self-referrals. After they go to there, we have a grad house, which is a little bit up, where they have more freedom, they can work more hours, there's a restriction on the hours that they can work, and then they go to a sober house. Sober house is more independent, they're still restricted, they're restricted there for 30 days. They have to do 5 meetings a week after their 30 days. I'm not sure how much they have to do in those 30 days, but they're still on the Vivitrol, Suboxone, Antabuse. I think all of my clients are on some kind of medication assistant, whether it's psychiatry or the MAT program. So when the sober house is, a lot of the clients that I interviewed left here to go to Fall River, and then say got kicked out of one of the residential programs, started their habit again. Now they're in Fall River, they're not back here. They don't have family support, so sober housing is really important here, and as is transportation, because you can get a bus on, Route 6, make it to Fall River for your, your therapy, but it's really hard. If you've got a psychiatrist, you've got your medication management, and your counseling. So that's 3 rides. PT1 forms can do, through Mass Health, but there's no education for that. The recovering addicts, they just don't know anything about that because there's nothing out here in particular. So it's the education piece, the funding, the rides, the living, the support, school support. I think it ends with it's really in the school first. So I feel really strongly about, the school because my kids are there,
And prevention is,
the prevention and a lot of the boys that are at my house, they're like, it's not going to happen to me. I'm only doing this one thing. I'm only vaping. And I'm like, but it goes into other things. It's a gateway. And they just don't get it. So education's key, I think. But sober houses, transportation. I would love to have a place where I can have basketball, have a drop-in section, have kids having a tough day at school. They have mental health. They're thinking about using. Their parents don't really. Some people are really not on the fence. They're kind of like, oh, I don't want to go to therapy, or there's nothing wrong with my kid. I want to have a safe place that somebody can come to and be like, you know what, Dina, I'm having a really tough day. I got my phone taken away, or whatever it may be, for mental health. Because right now, a lot of those kids come to my house, and I kind of am their counselor for, a couple of hours just to help them out and send them on their way. But yeah, it would be great to have something for teens and adults to go to. The old high school would be perfect for that.
I'm laughing about the high school because we're in this, big discussion about the old high school. And
I know.
all the
Yeah.
great things we could be
Yes.
doing with that building.
If we only had millions of dollars,
Correct.
right?
Yeah.
So,
But a drop-in, for these kids that need that outlook. I mean, parents are working till 8, 9 o'clock at night. A lot of my kids' friends are home alone. We're bored, let's go here, let's do this. They're starting fires in the woods. Heard that last week. I'm like, what are you guys doing?
okay.
But yeah, it is true. That's exactly, and I did do the surveys for you, and that's exactly what they said, all the transportation, family supports from guidance counselors at the school. Some of them are embarrassed that they have mental health, depression, anxiety.
So can you address, you just said
Yeah, I was going to give that update.
Okay.
We can
Yep.
tag
Thank you,
team it.
Dina.
Yeah. But I just wanted to make one follow-up on your question about sober living, just a little bit restated what you're saying. So, what I'm hearing is that the supports for sober living would be, if not direct access to a sober house, but it was those supporting things like information, kind of referrals, resources, community, sober activities, kind of, lots of activities and things that don't center around drinking, transportation to meetings, to medication-assisted treatment. So a combination of kind of community activities, physical places to be that aren't centered around drinking, and transportation to resources that aren't here. Would that be fair? Is that some of the things that you were,
Yeah, I was just curious, like I said, when, if you're in rehab and you're trying to stay off opiates, to me, there's gonna be something to stop that craving, whether it's, I mean, we've been using Suboxone and methadone for years and years and years. I personally think that's a problem fixing a problem. And I wanted to ask you what your thoughts were about Vivitrol. So I met with a few physicians who've been given Vivitrol, and they stand behind it. And I think that's, in my eyes, the research I've done, that's the best thing going, is Vivitrol. There's no withdrawals. It stops that craving. You get a 28-day shot, but you have to stay on it.
You have to stay on it, and from my clients that have stayed sober for 2 years, I started this 2 years ago, they've been on the Vivitrol with the Antabuse, which is also another pill that you can take when you get a craving, and that's worked. It's in your body for 28 days, you get the shot, but you have to have it with counseling. You definitely can't just, it's not a fix-all.
Right.
And they have to learn strategies while they're on that Vivitrol shot in order to get off.
Right. So, but one of the things is we don't really have control over people being on medications. It's perhaps communicating that that's available. It's perhaps connecting with the physicians in our community to even assess how many people do they have that they're doing medication-assisted treatment, so we can know, have an idea of that in town. But then a lot of people get their health care in Fall River, New Bedford, right? So, but certainly we know about medication-assisted treatment. It does greatly help with someone's sobriety, and so certainly educating people about that option would be important in our education. Do you have anything else that you wanted to?
not on that?
Okay.
Yeah. So one of the things that I agreed to do last time was to reach out to Dina and Stephanie Barbosa, who was here, about getting some questions into, to Westport residents seeking treatment, in Fall River at Star and Stepping Stone. So I shared some questions with Dina and Stephanie, who passed them on to someone else at Star, who I'm still trying to connect with. But Dina very graciously surveyed her clients who are Westport residents and shared the results. So honestly, I think if you want to, I just got them tonight, so I've glanced at them. But if it's appropriate to take time now, Dina is obviously more familiar with the results, if you wanted to share some highlights.
Yeah, I mean, it's,
Yeah, go to them.
the highlights are basically the transportation, like I already said, the education. A lot of the clients who are from here felt that they were kind of ashamed, and, they had their depressive symptoms. People would come in and speak about it, and they just didn't have anywhere to turn. Their parents weren't there for them, or the parents didn't believe in therapy. And the ages range from, I think, 32 to 65 or around there.
24.
Yeah, 24 is my youngest.
60.
And they formally are some here, and then they moved to Fall River. But it's the lack of education. They said, I really, people would come and talk at the school, and they'd be like, well, it wouldn't happen to me. It's not going to happen to me. And it's the support. They had nowhere to go here.
I mean,
They
I'm
didn't
hearing a lot of shame, just looking at
There
the
was
actual
shame,
clips that you wrote down.
guilt,
No, I felt like an outcast in Westport. There was no treatment. There was no one to talk to. There's nothing in Westport for treatment. What would be helpful? People were not aware of any harm reduction supplies here. Schools and town hall would be good places for them. Said the schools, they didn't get help. The schools just suspended me.
Yeah, that was a lot. I heard a lot about that, like just schools suspending them and not getting them that treatment, which would be through that program, because if you get caught with whatever at school, you get suspended, and then you get suspended again, and then you either get expelled or, I don't know, sent somewhere. But there's nothing here that we can help those individuals. I'm not talking about a different school, but someplace like a hangout, having them get counseling through that counselor, or hire a counselor in town to do it. Like, I just think that's lacking. And if we don't get them at the young age, and most of these clients did not have anything. No counseling for their mental health, so that's why they look to drugs, and they mask their mental health, and that's how they got addicted.
And several people said having outpatient or treatment in Westport would be helpful, which, I mean, that's a big nut to crack, but it does make me think about the shared clinician. If it were a clinician who could do substance use-related counseling as well, and would be in the schools sometimes, that would be a huge asset, or whether through that program or separately, having some access to outpatient treatment, even if it's not like a clinic, if it's certain days, certain places.
Yeah, because the children right now at the Westport schools, if they get caught with any kind of drug, they're just suspended and moved on. Maybe they should have therapy twice a week to talk about their mental health and why they're doing drugs.
Well, it's like jail diversion. You want
yeah, like-
suspension diversion.
Get the parents involved, have them come in for a session, do family therapy if needed, so.
It's unfortunate that Laura wasn't here because she was going to speak to the adjustment counselors at school and come up with some needs. And we know that there is a clinician that they now have there that will see students, but I don't know under what circumstances.
Yeah, I mean, I'm not gonna say forced, but it should be like a requirement. If they're struggling with drugs, then they're probably struggling with mental health. And I feel like it's kind of just like, okay, well, they'll be fine. And then next year it happens again, or, I just spoke to the guidance counselor this morning. I was there for a meeting, and she's like, we have to do something. And I said, I know, that's why I'm going,
Well, and in addition to all the work that she's doing with you, Dina and I are going to go before the PTO next month. They didn't have any time for us this month, but we're going to go next month just to tell them about what this committee is about the funds, and how can they look at, maybe there's ways they can access funds to help the kids in schools and spearhead something and apply for a grant when we get to that place. So I strongly identify with the need to be in the schools, and so I'm sorry that Laura wasn't here to tell us how that went. So hopefully next month she will, and you and I will go to the PTO.
Sounds good.
And I'll come, as I get information from STAR, from Westport clients, I'll bring that back as well, and maybe someone from there can share it as well.
And do you have anything?
I do.
Okay.
So Detective Donovan got back to me. There's been no reported overdoses in town since our last meeting. Her and Officer Chicker are still doing call-outs. They're going, I think they've gone 3 separate visits, 1 per week for the past month, to different locations for both substance abuse and mental health. So that's still going on with the clinician from Easton. Myself and Detective Donovan met with Nikki Fontaine from FAST.
Okay.
That was a very great conversation. I highly recommend for her to come and speak in front of the committee in the future. I think she can help us and provide us maybe with other guidance, or maybe other alternatives to maybe how we want to proceed forward when this grant expires. She did talk about, I actually quoted you about building bridges to other services. That's something she definitely spoke to us about. Again, I think I'd rather have her here than to me talk about it. I think I'd do a disservice by bringing, what she said. It was definitely a lot.
I did reach out to her, sent her an email, and asked her when she has an opportunity to give me a call, so I haven't heard back from her yet. Certainly for the next meeting, I'm hoping that she'll be able to come and talk with us.
And maybe what I can do in the meantime is I can reach out to other chiefs in specifically Fairhaven. I have a very close relationship with, if they're itching to take over this, see where they're at, what they want to do. And I can speak to the 4 other chiefs in our collaborative to see where they're at regarding the opioid task force and stuff like that.
Beautiful. Great. Do you have anything to report, Craig?
Nothing new.
Okay. All right, well, I have a couple of things. One, did anybody get to watch any of the webinars yet from Care Mass?
No.
All right, so I did in California when I was on my vacation.
Wow, good for you.
I did watch the tips for smaller communities. And I found it interesting because some of the questions that we had were answered. So one of the things was about administrative costs, which we wanted to make sure that we were okay in using costs, and there's no problem. They haven't come up with a percentage that can be used yet, but certainly even if space needed to be rented to run a program, that could be included in the use of the funds. Some of the other suggestions were designing an outdoor space to memorialize lives lost to a drug-related overdose. And I thought about that because I don't know if it's in, what town it's in. Was it Fairhaven or Mattapoisett? They have flags in front of, to identify all the lives that have been lost. So that may be something we want to do to increase awareness, is somehow create something in town that we address how many lives we've lost, that we have accounted for, and maybe create something in town. It would be nice if we could do something around Mental Health Awareness Month, which is in May. But I thought that was a nice idea, was to try to create some kind of space to memorialize those lives lost.
August 31st, I think, is the overdose awareness.
That would be a good,
Most
you know,
of the towns have events on that day.
it would be a great time to set something up. So we'd have to kind of look at what we might want, where would it be? I kind of think in front of where the police and fire station is, because there, it's in the, I think it's at the fire station at that town, in front of the fire station, because of all the EMT paramedic calls that they got, so, and the responses. The other,
Or in front of the school,
yeah, it could be too,
you know, there's a big grassy area, and a lot of traffic there.
yeah. Okay, well, we can
Either.
talk
Yeah, I'm
about
just
that if
thinking-
that's something that we want to do, but I'm just bringing to you what some of the suggestions were. Launch a stigma campaign, which would mean, you know, doing posters, doing signs, having some kind of a educational session, and Olive would be really good for that, because she had done a stigma, she held a educational conference for people who work in public health, and it was around stigma. And I heard that it was really good. Did you go to that?
I went to that, yes.
And did you think that
It
was?
was great, yeah.
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 So maybe we can get Olive to help us look at maybe what we could do in town. Doing a youth risk survey. I believe that Laura was going to do that at some point before this committee was started, so I really want to talk with her about that. Host a resource fair. That's another way, if we could do a resource fair where we can do a giveaway, you know, and that's allowed. Some of the things allowed to pay for incentives, pay people to come, to be educated, food, gift cards. Of course, they said cash was king, but I don't know that we want to do cash, but offering childcare, so that if we're targeting parents, or, you know, parents who are struggling, who may need childcare, so they can get some support and some help. And as far as medical items, because that was a question, a couple of people asked, can we get an AED? And they said no. The medical items have to be specific to overdose, or opioid overdoses, or in prevention. If there was, you know, so it's sort of like the test strips, the fentanyl test strips, that kind of thing. But not, it can't be a general use item. May be able to use space for rental. And they also talked about a family fund, but there is a family fund that is set up through mass.gov that they have put money in, so if a specific family needs more assistance, they can access that from the state. And that was pointed out during that it doesn't have to necessarily come from our funds, as Fall River did. Fall River set up a fund, so the family needed assistance, they came and they applied for the funds. I don't know how they organized that, I would have to check with them. But the other thing is bridge funding, getting people to recovery or getting programs to our area. But it has to be managed. So that would be the issue, is how you pay for who's gonna manage that, or how that's gonna. So, and they said, if we have any questions, just contact Karen Mass. So I still haven't set up a one-on-one appointment yet, but I found this to be very helpful. They also talked about partnering again, partnering with Peer Support Center or harm reduction programs. And I know that there are certain programs that are already set up, and whether or not, and this is something I've been thinking, can we, if they can come one day a week to Westport and provide some kind of service, and we could financially, the fund, our fund could financially support that day, that they would come to the town. So rather than, we don't want to, build a whole new program, but if there's already one in existence, what would it take to get them to come to Westport and provide that service here? So, those were some of the items. But it was very helpful, and they all are on their website, they're recorded. So if you want to go back and listen, there's still one on a small community that I think it was Swampscott, but I haven't looked at it yet. But they do have all those resources right at Mass Care. The other thing, I'm trying to think, I don't know how to, I have recently become a member of another committee, another board rather, and it's called Star Kids. And what they do is they provide scholarships to kids whose parents are incarcerated or struggling with substance use. And so they have built this program where they provide funds to kids whose parents might be incarcerated or struggling, or they may be living with their grandparents, to go to summer camp, to buy that laptop so they can do their work at school, that they can go to not necessarily therapy, but other enrichment experiences. And I really like that idea because there are a lot of kids that their grandparents may be struggling, they just are getting to school and coming home, but they don't really have enrichment. So it's sort of like Dina said, after school stuff, like what kind of program can we have set up for these kids who may be missing a parent and being raised by grandparents, or with a parent that's really struggling. So it's something that we want to think about. I have access to them now that I'm on their board, so I can pick their brains and get information about how they get applicants for the
Is this
the
local, is
scholarships.
this certain towns, or is it?
It's in New Bedford. And there are others around. It was started by Dr. Timothy Flanagan. And he's also the deacon of St. Teresa's Church in Tiverton. And I know him because that was a church I was part of. And so the reason why it was set up was he would go to he's an infectious disease doctor. So part of what he did was also he went to see people who were incarcerated who might have HIV, right? And then when he talked to all of them, he said what their worries and concerns were. They always said they're kids. And so that's where Star Kids came in. They developed this to help kids whose parents may be incarcerated or struggling with addiction. So I just want that, I throw that out, that that's something, I have a real focus on kids and prevention and getting to these kids when they're young and giving them opportunities and support so they don't get to the point where they then start picking up and using themselves, so. And
Do they have a website that?
they must have a website. I just
Don't
went to
know
my,
for a fact, but I would assume so.
yeah.
I've heard of them, which means.
Yeah,
they
I have-
a website.
Yeah, no, I have, they've really grown. I mean, they have 150 kids in this program now. They pay for them to go to private school.
Yeah, I remember.
They pay for them to go to Stang, to a lot of the Catholic schools or the private schools. They'll pay the tuition. So they get a $1 million endowment from someone, but the thing is that they look at it, it's supporting these kids, and not just in education, but in all their life experiences and giving them opportunities. So is there, something we can do in creating a scholarship to give some of these kids an opportunity they might not have? Trying to think of what else. I know there was something else that I did. I also, I know that we haven't started creating a grant, a format for a grant, for requests for money in grants. And I do have one that was sent to me, that's a template for applying for grants. So I think that's the other thing, because if our goal is, we talked about our goal, right? And our goal was by the summer, spring, summer, we would have the grant application ready to go out, to have people apply for funds, and that we were hoping that by the fall, we would begin distributing some funds. So pushing this along, we really need to have the grant application ready to go in the next 2 months. I do have a template for that, and I'll share it with everyone. A friend of mine I talked to about this today, he sent me a template, so. But you've done a lot of grants.
I have, mostly in the reading and design side, not on the applicant side.
Okay, but on the
I
design.
mean, over my career, yes, but I mean, more recently, it's been
Yeah.
reviewing grants and evaluating funds,
Okay,
and the process you want to use to do that. What, do you do interviews, do you do, it depends on what you're looking for. I mean, some people do it, some foundations do entirely paper review of applicants, and others will not solicit. Now, we can't do that, but some don't even solicit grants. They seek out applicants, and then they do a little bit of vetting. As a public, as a community, we have to do, at best, we can do a little bit of both, where you try to, create an applicant pool that would be qualified and meet your objectives, but knowing that we have to conform to all of our procurement requirements regarding RFPs. Because the grant is, in many respects, is issuing an RFP or a grant program.
I mean, the other issue with that, and I'm not sure how clean the process will be or how fast things will turn around, but once, say, somebody comes and fills the application out, we like it, we think it's a good program, and we want to support it, and then they're asking for $10,000 to begin this program. Then the next step is to the select board, right? So we can make recommendations to the select board, that's what we're doing, but then we have to go to the select board and say, this is where the money goes. So then what happens, being a select board person, after that? Who is going to manage how that money, when that money is given?
I think that at some point, we're going to have to work with the town administrator to really clarify the roles. I don't think that, candidly, I don't think the select board is in a position of selecting grant recipients. What they want to know is that the money's being well spent,
Right.
and they will probably want to be briefed on, before an RFP goes out, on what the criteria are. And then when you've made the awards, you might go back to the select board and tell them who's got the funds. But to get our hands that immersed in grant-making doesn't make any sense. What we need to do is to make sure,
Microphone.
make sure the money's being well spent, and that we understand what's happening.
Do you think it would be helpful if I went before the select board and just talked about what we've done so far and to try to understand and unravel that process before we start to request?
I think if we're a little bit further down the road, I think right now, I mean, this is good for us, and this is good for the folks that we want to directly partner with, the departments and town employees and contractors. But I think, we're going to have at least one new member, or we're going to have one new member on the board. And, that could change dynamics. That could, so we want to make sure that the select board is invested in the process, understands what's going on, but gets to know what this group is doing, so that they/we can trust the capacity and the insight of the group.
Can I just toss in about our, I was just looking about the potential timeline. I think I laid out that if in May, like a subcommittee tries to draft a request for proposal, that we're on track. I mean, that we could even, to get, say, I think we would said,
And that would be a good time.
yeah.
If you get a draft RFP or of such direction to saying, this is what we want to do, this is how we, and, you know, the other thing is, you don't get an hour in front of the select board.
No, I know.
You don't get 15, you barely get 15 minutes. So it's probably best to make it tight, and allow time for questions, and allow time for the public to be able to make that part of their participation in the meeting.
Well, no, part of what my plan would be is to sort of give a summary and, so that it's part of your packet,
Yeah.
so that you can look at it before the meeting and then just appear and ask if there's any questions. But I'm concerned about the process, and one of the reasons why I'm concerned about the process is Bob has agreed to take our minutes, and he did last month, and there was, something wasn't taken care of. So, Bob, can you just, are you able to address what happened that,
She just hasn't set up an account, I
Right.
guess, for you, for me to charge you.
okay. So even though we've had a separate account that was established,
Right.
she wasn't ready for that. But I had spoken to her about it before I asked Bob to
Well,
do that.
Bob and I have another hat in this town, and he is, I chair the Affordable Housing Trust. And Bob is staff to the Affordable Housing Trust, and we just happen to do RFPs for housing grants and things of that nature. So Bob has a good understanding of the process and walking these things through town hall. Or running up a flag if they're not going too well through town hall.
But what I'm saying, though, my point was that I thought he would be able to just
Yeah.
plug in and then get his payment, and that didn't happen. So I don't want any glitches to happen when we're starting to.
That's not a select
request
board,
funds.
that is a town administrator,
Okay,
town, and town accountant function.
okay. Well, I know that we have an election coming up next month, and then we have the town meeting. So it probably is going to need to wait till after that.
I would guess.
Yeah, well, I just know that, with all the warrants, I'm sure that the town administrator's not going to be thinking too much about this. He's going to be thinking about the town meeting, and
Right.
so, okay. All right, I think that's all I have. Are there, so we have committee planning next steps. So one of the next steps is to continue to collect data, but then there's a point where we're going to have to move on what the data that we have. And the thing is that we can also reevaluate, because as time goes on, as money is being distributed to others to use, like if the police department uses it, if the school department uses it, if the clinician comes in and says she wants to run groups for kids who need support, those kinds of things. So we should be ready to move forward with that. And then, again, we're not stopping once we make a decision about what we're going to do. There may be new data that comes in that will then direct us to try to do something else, or another hole that could be filled. So I don't want us to wait until we have all the data, but that we have some data and a good amount of data. So that when Dina and I meet with the PTO, I'm going to have a date for a focus group and invite them to come to the focus group. And that's a key demographic that I really wanted to connect with, as parents and kids, the concerns for kids, so. Okay, so are there any other next steps that we need to plan for?
I mean, I think inviting perhaps Nikki Fontaine to
Yep.
the April meeting. Is there anyone else? I mean, probably one person per meeting is good, so, yeah, that might be it.
Well, that's my plan, yep.
Yeah, and then I think, just from looking at what we had discussed before, yeah, kind of continuing to get input from people with lived experience. We talked about adjustment counselors focus group. Is that something that you wanted to do or
I can-
combined with PTO?
I can send an email to them and ask them if they have time to meet with me. I know Laura was going to do that.
Okay.
So, I don't want to step on her toes. I mean, I can send her an email and ask her if she was able to do
Yep.
that, and if not, then I will.
But that's all I had, is sort of PTO, adjustment counselors, people with lived experience, and then having Nikki come in. I know you're continuing with the AANA groups. There was one other thing. Oh, yeah, right. If David interviews providers, that would be the other
Yeah,
input.
the other.
And you were going to reach out to police chiefs.
Yes.
In the area.
Yep. I will.
That's good.
Seems on point.
All right, good.
Next meeting is?
Well, wait a minute. Topics not reasonably anticipated 48 hours in advance. I was just thinking about this, so that's why it's not. It's just, I would like the committee to think about, Mental Health Awareness Month is in May. As a rule, I have, since I've been on the Board of Health, run some programming during the month of May. If you think of a program, I'm going to try to get someone, I've already reached out to Stephanie, to ask her to ask a clinician at STAR if they'd be willing to come and talk about dual diagnosis or mental health and substance use and how they can be connected. It's sort of the chicken and egg thing. What came first? The substance abuse caused some mental health issues, or mental health issues led people to use substances. So I'm working on that, but any other suggestions would be greatly appreciated. I'm just wondering if that person who's speaking, doing that presentation for us, would be willing to do something in combined with another therapist that I have that talks about specifically about marijuana use and the impact on adolescent brain.
He's got quite a background and all that. I can certainly reach out to him.
If you would, and send me an email or send me, introduce us so that I can look at that, because I wanted to put mental health issues and put substance use in as one of the topics. So if you think of anything else, just to send me an email. Do you have?
I am thinking of something. I think this came up at one of our meetings. Actually, yeah, it came up at the previous focus group we did. I wonder about partnering with the Land Trust on something in that month about nature as medicine or nature in recovery, because there had been somebody who was interested in doing that program. And I'm happy to.
Hosting a walk or something.
Could be a walk, could be a speaker, but I'm happy to also help make the connection with the Land Trust on that.
Okay, if you could.
Yeah.
And then they can contact me because I work on the programming. What I end up doing is I do an article in Shorelines. It's called Health Notes that all of us on the board do, and I'm going to focus on what's happening in May. So I'd appreciate.
Yeah.
Thank you.
That's great, thank you for that. I had another thought, it sort of continues but extends beyond May. Hearing today about the kind of care package and things that are available, I thought, gee, I wonder if there are upcoming community events in the coming months where it would be good to have almost a table with someone from our committee, we could, and resources from the COSA program and the care kits, and we could sort of say, give us your input. Maybe there's giveaways from other, like STAR or something, So I'll keep my antenna up, but if folks had thoughts about, is there anything upcoming that we could be visible, which is nice, and sort of to get input, but also start to share resources and start thinking of our role in that way.
That's a great idea. Okay. All right, so I think we have to just make sure we have the next meeting set, which I have as April 15th. Oh, tax day. Okay, at 6 p.m. So if there's no other business, I entertain a motion to adjourn.
So moved.
Okay, all in favor?
Aye.
Thank you all very much.